Welcome to the Community Collective podcast. I'm Jenni Beamer, the flip-flop agent, and I've partnered with the Davison Area Chamber of Commerce to bring you the stories that shape our local communities. In our third season, our focus is about connecting, learning, and celebrating the voices that make our communities unique. Join us during this third season as we engage in thoughtful conversations and insightful moments. This podcast is commercial-free and supported by both myself, my co-host, and our guests. We would be so appreciative if you could like, share, and subscribe as we continue having conversations that matter and cannot thank you enough for taking the time to listen.
Hello and welcome to a new edition of the Community Collective podcast. I am Travis Howe, the Executive Director of the Davison Area Chamber of Commerce. My co-host, Jenni Beamer, the original flip-flop agent, is busy right now. He is on his way to the RE/MAX International Conference, which I'm jealous, but know he will come back with lots of information to share with me. But today, we have a guest who is really involved in an organization that we're familiar with, but might still not know all the details and what all goes on with it. So I am excited to welcome Jenni Beamer, who is the Senior Executive Director of the American Cancer Society of Michigan. Jenni, how are you today?
Hi, Travis. I'm great. Thank you so much for having me.
Yeah, no, I'm really looking forward to it. I know we've had a chance to, bump into each other around the community and kind of talk
Yeah.
a little bit, or our kids one year played flag football together.
Right?
So I think we've had a chance to talk, but never really about what you do.
I know. I love this and I love the opportunity because you're so right when you just kind of open in general, people, the community, society knows who the American Cancer Society is, right? It's a name, it's a large name, but the details about what that means and what we do, it needs a conversation. So I appreciate this.
Yeah. So, you know what? We'll jump right into the first question because I really feel like there's going to be a lot of information you can share. And I want to make sure our listeners have the chance to get educated and get excited about what they can do and what's going on. So, Jenni, what inspired you to become involved in this particular cause? And
Yeah.
how has your role with the American Cancer Society shaped your perspective on community health?
Yeah, well, so I got involved in college at Michigan State. I volunteered with the organization, and it was really through an event called Relay for Life that was on campus. And that was one year. In the following year, my senior year, unfortunately, my aunt was diagnosed with, and my major was communications with a specialty in public relations. So in my public relations class, we needed to choose an organization to really do our entire portfolio on. Well, being that she had been diagnosed, I was sort of looking at cancer information, which at the time I'm glad I knew to go to the American Cancer Society as a trusted source of information because you don't want to go to Google.
Right.
So I was sort of looking into the organization already because I had volunteered. And that led me to choosing that organization. Well, unfortunately, she lost her battle to cervical cancer. And, I went to my professor's office at the time to let her know that I would not be there the following week because I was going home for a funeral. And when I walked out of that office, that's the time where we had I'm sure they still exist, I know, but community boards, there was a board outside of her office and there was a flyer on it that said American Cancer Society interns needed. And you could kind of pull the tab. And it was like the only thing I saw when I walked out of that office. And I absolutely pulled that tab and called. And it's now almost 22 years later. So,
Wow. And I feel a lot of people that work for organizations like the American Cancer Society have a personal connection
yeah.
with it and have a history of the wonderful memories of an individual that had to go through that. And you find ways to get involved, and you said volunteer. And I remember when I was in college, the old like community boards where you would take a piece of paper
Right.
down or anything like that. So what a wonderful sign that, I mean, unfortunate thing that you had to go through, but you walk out of this office and you see that. And I think that
Right.
makes it even more personal for you and a great story to share why you have a passion to be
Oh my
involved.
gosh. So that was really, the reason for the kind of the launch further into um, sort of dedicating at least some of my time to this mission of really ending cancer as we know it for everyone. And the number of people that I've met throughout these years and the lives impacted and the survivors right along the way has been just incredible. But yes, I'm absolutely personally very passionate about this cause. And so that's what kind of led me to. But to your second point of your question around, how has my role and my time with ACS shaped my perspective, I think you said, on community health in general. And that's a great question because what I've really learned more of is I think validation of what a lot of people already know or assume or hear, which is it's a team effort. The American Cancer Society is a volunteer driven organization. Nothing happens without volunteers. And I swear the world will simply fall apart if people didn't volunteer. But it's a team effort, right? Whether it's your family, neighbors, your workplace, like your place of worship, just like sort of people say it takes a village to raise a child, it takes a village to move community health forward, whether it's for an individual or a broader base. And also, unfortunately, we say kind of maybe people have heard that the term cancer doesn't discriminate, right? Anybody can unfortunately get diagnosed with cancer. But unfortunately, the outcomes, it does matter who you are, where you live, and essentially access to care. Access to care is an absolute huge barrier to really being and staying healthy. So whether it's, from the American Cancer Study perspective, we really put a lot of focus on removing barriers to treatment because certainly if people can't get treatment, they can't get well. And two of the largest barriers are transportation and lodging. And so we invest dollars, grants into some of a lot of healthcare partners that already have transportation programs so they can keep them up and running. We also have a volunteer driven, quite literally, volunteer driven program where we rely on volunteers to drive patients to and from treatment. Same with lodging. Many people have to travel for their treatment. Maybe it's a um, specialized treatment or a clinical trial that they're in. Maybe they have to travel to a different state. We have Hope Lodge facilities. We have 31, looking to actually add at least 10 more in the next 10 years. But if people have to travel for treatment, they can stay at a Hope Lodge completely free for however long they need to. So they don't have to have that extra burden of wondering how on earth they're going to pay for it and where on earth they're going to stay. We also work with hotel partners too. So it's kind of like, call us, call the American Cancer Study because we are really working hard at removing barriers so access to care is a real thing for everyone.
Well, and I know, I mean, I had the opportunity recently to tour and spend time talking to individuals as an example of like housing and traveling.
Mm.
The McLaren Hospital House or Hospitality House here in the Flint area. And I know they were talking about, the resources they have for family members and individuals, patients getting that cancer care and not knowing what to do. But they
Yep.
also mentioned, yeah, that there's partnerships with hotels to kind of make sure that, yeah, if you're traveling from far away or, that financial burden that comes with treatment, that there's all these wonderful resources. And American Cancer Society is one of them. So, Jenni, if someone is, I mean, unfortunately, maybe struggling with this, or they have a loved one that just got diagnosed, how do they go about reaching out to the American Cancer Society to learn more
Yeah.
information about these resources?
Yeah. So the American Cancer Society is available 24 hours a day, 7 days a week so we have a national cancer information line that you're always going to talk to a live cancer information specialist that's trained. We also do, there are physicians, nurses as well to talk to, but there's always a cancer information specialist. So let's say it's 2 o'clock in the morning and, you know, maybe yourself or a loved one had been recently diagnosed and you just can't sleep because you have there's all sorts of things going through your mind. You can call. So it's 800-227-2345. Don't expect everyone to remember that, but cancer.org is our website as well. And certainly if you just Google American Cancer Society, you can call us. You can live chat as well. Actually, on average, like this past year, over 350 people per day reach out to us for resources, help. And what we hope to be is, we are not going to, we don't recreate resources. There's a lot of organizations that do amazing work, and we work together with them. And we have a database full of resources so that our cancer information specialist perhaps can ask you questions to find you things that you didn't even know you needed or were available for you.
Yeah, and when that's great, I think for our listeners and hopefully people that they can share this with just for educational purposes, but then for a resource for a family member or friend that's
Right.
going through something like this. So, and that kind of helps out with our next question. Jenni, considering the rise in cancer cases among Americans, what strategies is the American Cancer Society employing to raise awareness? And what message would you like to emphasize to our younger listeners?
Yeah, you're right. Incidence rates are on the increase. And I'll say, I'm doing air quotes, good about that could be, is that it's because people are actually finding cancer. We want early detection, right? We want people getting screened. So you could potentially see, expect an increase in incidence rates. What's to be celebrated here is that there is and has been a decline in cancer mortality rates. And so in each year, the American Cancer Study comes out with the cancer facts and figures that really our medical community broadly relies upon. And in 2023, we announced a 33% decline in cancer mortality rates since 1991. And that's a really big deal to note because just the year prior in 22, it was 32%. There's been this steady increase of decline, right? An increase in that percentage number. Now in 2024, what we were just able to announce is stability. So it's still at 33%. Now this is good, but obviously some things we need to continue to do and that we're employing to make sure that that trajectory keeps going up. But a couple things to pull out that I want to highlight is while we still have this overall decline in cancer rates, overall, a mortality, a couple things. Prostate cancer, while it's an overall decrease, we saw a 3% increase specifically in Black men. We see colorectal cancer being diagnosed at a younger age. And one that I also get personally passionate about that's really great news is the HPV cancer vaccine. So one thing we saw last year was a 60% reduction in cervical cancer cases, which is huge.
Wow,
But you know
yeah.
why? Yeah, what it can be directly linked to is the age at which people started getting the HPV cancer vaccine. And so we know that vaccine actually works. The data now, there's been enough time that has happened that you can see the exact correlation and the data linking to that doing exactly what we anticipated it doing. The reason I say that's really exciting for me personally is when I talked about my aunt passing from cancer, it was from cervical cancer. And while I don't know that it was related, that it was HPV related, over 90% of cervical cancers are related to HPV. And so it's a high assumption. But the fact that, now my 3 kids have all gotten the HPV cancer vaccine, and I can quite literally do something to make sure that they do not get the type and pass from the type of cancer that she did. That's science. Like we are a data-driven organization. We are investing a lot of dollars into research and science, and that's really exciting. So a couple of things there, I guess, that I just wanted to pull out, but it all comes down to screening in a lot of cases, right? Using what we have. And I know that seems so simple, but it's not, because there's a lot of just barriers to that. And so I would say, when we think about, you asked about young listeners. We're doing a national campaign, and maybe you've seen it. It's called I Love You, Get Screened. Very simple. I love you, get screened. And I would charge everyone, and certainly young listeners, to talk to their parents, their grandparents, everyone that they loved, and say, hey, I love you, get screened. Like, because the people get screened when they're reminded or asked by a loved one.
Yeah. Well, and I think that's amazing too. The emphasis on how science is really playing an important role in just understanding probably
Yeah.
each form of cancer. But I think the important part is too getting that yearly physical and screenings
Yeah.
starting at a younger age. I mean, I know, I think of like our kids. I mean, they're getting their physicals for athletics and doing part of their yearly well visit. But as we get older, and I'm in that category too, where
Yep.
I have a family history of a couple different forms of cancer, but a couple other things. And I've been trying to get better the past several years about, okay, I'm reaching an age where I need to make sure I'm going every year just to get checked up. And, just because of that medical history. And there might be people that don't know their family history. Go
Yeah.
schedule a doctor's appointment, look up resources. I mean, that's what I'm getting from you is, tell us, like you said, tell someone I love you, get screened. And I think that's important for all ages, like you emphasized. And I think there
Right.
is more and more people that these numbers are showing that, the 33% decrease in mortality rates. Some people might be like, okay, that seems like a small number, but I think for you guys, that's a huge accomplishment to say for anyone getting diagnosed, like these numbers keep going up as long as you're getting
Yes.
screened early and detecting it early, which is, I think that's the big emphasis. And I love that you're sharing that and making sure that everybody knows.
Right, absolutely. And there's so many things, I mean, I know, Travis, believe me, I could go, and I know we still have time to talk, so we'll go into a little bit more, but I could go on and on about all the things that we're doing to make sure that this actually happens. But at the base, I mean, some good news is that really about 45%, I mean, nearly half of cancers really can be avoided even by behavior change. And like, I mean, I'm someone to say like life is it's hard to change behaviors, but they really are avoidable. But what we are focusing on too is just sharing the message, sharing the reminders, getting screened. And we can dive into that a little bit more, but also additionally for outside of that scope of things that aren't in our control, we're investing dollars in research, billions of dollars in research that is absolutely paying off on a daily basis.
Right. So, I mean, and I think that kind of helps out with what we really want to talk about next is what are some of the preventative measures, even though we've already talked about a little bit,
Yeah.
or early detection steps that you advocate for, the American Cancer Society advocates for, and how is the group overall working to make this information and testing more accessible?
Yeah, good question. So, one thing that I haven't touched on yet that really we're working hard on also. So, I talked a little bit about and mentioned we certainly invest dollars in research. We invest dollars in programs through access to care. So, patient programs to removing barriers. Another huge way that we are going to ultimately work towards ending cancer as we know it is through advocacy. So, really, the American Cancer Study is the second largest funder of cancer research next to the federal government. So, the largest private funder of research, but the federal government is way above us. And but
Yeah.
but the way that they're going to do that, right, is by us as individuals, as community members, holding our legislators accountable to different, the federal government, the state government accountable to different policies that whether promote cancer prevention, expand access to care, different things. So we have an organization, really our legislative arm, if you will, the American Cancer Study Cancer Action Network. that we do just this. So a couple things, like examples that I could pull out really from Michigan right now. Um, this past year, we were able to celebrate that after literally 15 years of advocating for it. And when I say we, I mean people like you and me, volunteers, people going and talking to their legislators, writing emails, making phone calls for what was called the Oral Chemotherapy Fairness Bill. And
Yeah.
I don't know if you or anybody has heard of that.
So on a side note,
Yeah.
I know a little bit about it, not a whole lot, just because previous job in Lansing, I remember getting letters from individuals and on
Really?
lobbying days, having the oral chemo. I know it's been for years. So
Yes.
it is. So fill us in on that. But I was excited because like when you mentioned, it's like, oh, I know about this topic a little bit. So
Oh, cool. Good. Yeah. Yeah. It's been a long time, but finally it's here. Really at a baseline, it's saying so there are some individuals who their chemotherapy, right? Most people know most chemotherapy is through an IV, intravenous chemotherapy. Well, there's also chemotherapy in pill form. And for some people, that's the best option or the only option that they need to get their chemotherapy. Well, insurance doesn't cover that. It didn't cover it. And so we've been advocating for 15 years for insurance to cover chemotherapy in oral pill form. And it finally got approved. So this is going to quite literally save lives and certainly save people thousands and thousands of dollars that they were otherwise having to pay out of pocket just to get treatment or just foregoing treatment overall. That's what they would do, right? Because they couldn't afford it. So that's something we do. That's something we've just been able to celebrate. We're always working toward tobacco prevention and cessation funding, getting more money in the Michigan budget. Michigan's ranked 49th for spending in tobacco cessation and prevention, which is tragic. And we are the 15th highest state for smoking rates. So we continue each year to advocate for a larger budget for that. And also coming up, there's been some tests or some states. Indiana just actually passed this, but Michigan, it'll be coming soon. We're working on education right now, but for biomarker testing. So biomarkers are what like allow doctors to precisely target the cancer. So patients like might not have to undergo more treatment than they need to. And right now, most insurance doesn't cover biomarker testing. So through legislators, like right now, we're working on an education campaign to raise awareness about biomarkers and really that need for lawmakers to hold insurers accountable to actually covering that expense. So you'll be seeing a lot of noise around that soon.
well, and I think it's a great example of your all's commitment is that you keep working
Yep.
towards educating and getting involved, especially in Lansing with, with term limits and staff members changing over or legislators retiring or being termed. I mean, you guys are constantly having to get in there and talk to them. But I will say, I mean, on my previous job working in a legislative office, we do look over everything people send us and update the legislators and make sure they know what's going on. And when you guys do like a lobbying day and you have people
Yeah.
from their district that can sit down and meet with them. And I mean, my former bosses, I think that meant more to them because it gave that personal, connection that says,
Yes.
oh, this person lives close to where I am. But, and I like too that the options, I mean, because you said the oral chemo,
Mm-hmm.
I kind of compared it like a little bit with education. Every kid learns in a different way. And then
Mm-hmm.
you go into cancer treatments. Everybody their bodies respond differently to different style treatments, and depending on what they have going on, it is. So I love that you
Yeah.
guys, you don't give up. You constantly have to keep educating, getting involved. And for anyone that's listening, that's a volunteer with you all
Yeah.
or has been involved in it, keep sending information to your elected officials. That's what they're there for. That's, you guys provide resources to say, hey, this is the information that needs to be shared. And it does. It does make a difference. And
Yeah.
offices do listen in Lansing and other places as well.
Yeah, I love that. And we actually just did our lobby day, our cancer action day on March 13th. So we did have people, volunteers, and I like what you said. I want to bring up, when people are thinking about it, maybe listening, especially even for a younger audience, you know, are, you don't have to be, I'm doing air quotes again, into politics to be a volunteer from an advocacy perspective. You just have to be a voter, and someone interested in passionate about cancer and impacting lives. But, if anyone wants to volunteer with us in that way, it's another way to volunteer.
Right. And I think that is a good question right there. How can individuals and communities get involved with the American Cancer Society? So you mentioned your lobbying days, and you guys have events, right, that people can volunteer or form teams. Kind of fill us in.
Yep.
What update us about these things?
Yeah. Okay. So many things, but since we're really, we are, of course, as everyone knows, a national organization with, though, a grassroots local presence, like uh, quite literally everywhere, and absolutely rely on volunteers. And so if you are, looking for different ways to volunteer or just get involved from a fundraising perspective, I can speak from, sitting here in Genesee County in October. Making Strides Against Breast Cancer walk in Flint is just a blast. So if anybody is perhaps passionate about breast cancer or really any cancer, but wanting to form a team and kind of have some fun, do a 5K non-competitive walk, that's coming up in October and called Making Strides Against Breast Cancer. So much fun. There really are those all across the state and different events across the state. But also if, you know, looking from a perspective of volunteering time, I mentioned early on in this conversation, Road to Recovery. Actually, I didn't say it was Road to Recovery. I said a transportation program. So we have a transportation program that we rely heavily on volunteers. So maybe someone has one day a month, one day a week, one day every 2 months. It's really like an app. And it's sort of like an Uber or Lyft, right? You can accept different rides. And what it is you volunteering to donate quite literally your passenger seat and take people to and from cancer treatment. And right now we've been getting that program up and running since COVID, since we of course had to shut it down for a while for safety. But just about 6 months ago, we were only able to fulfill 38% of the ride requests that come into us. Just in 6 months, we've been able to increase that to 50%. So right now, 50% of those that call us, we're able to fulfill those because of volunteers. We need that to keep going, and we only can get it increased if we have more volunteers.
And I feel like that is such a simple way to
Yes.
volunteer and help. It's right. Do you have to be a certain age, or I mean, obviously you have to have a driver's license, but is there any age limit if someone, say, a senior in high school is interested in volunteering a little bit just to help drive people around, or do they need to be an
Yeah, good
adult? Yeah.
question. Over 18, and yeah, there's options for everyone.
Yeah. So, and I think that's great. I think we all know about kind of and I think that is, are they able to find out information on those through the American Cancer Society website to find a local?
So,
Okay.
yep. So anybody could go to cancer.org if you wanted to take an extra step and do cancer.org /Michigan. You're going to see, and you're going to be able to search all different Michigan opportunities. I'd also add in, it doesn't have to be event or campaign based, but if someone is a company that's looking to get involved, we even work with companies that want to do maybe a specific fundraiser within. Perhaps they want to simply, and I say simply because it's easy, add us to their payroll deduction. People give when they're given the opportunity to give. And so, and also through education and awareness, if people are willing and they have monthly newsletters or different things, we have content they can add in. So we're always getting creative and working with large companies, small companies. Just how do you want to give your staff and your community a way to give back through you?
Yeah. Now, as we kind of wrap up here, looking forward, what are, and you've mentioned some new initiatives or programs that we can expect from the American Cancer Society that address rising concerns of cancer, but especially with the younger populations?
Yeah. So Okay, I will not do justice to sharing everything because there is a limited amount of time, but you can always check out the website for more information. But a couple, or at least one thing right now, and a couple things I want to highlight. We are excited in Michigan to be one of the 20 cities that will be launching this cohort population-based study. It's called the Voices of Black Women. Now, people may or may not know that Black women are very, the cancer mortality and incidence rates are much higher. When it comes to overall cancers, it's 12% higher. When you're looking specifically at breast cancer, 41% higher. Now, we have a lot of work to do as to figuring out all the reasons why. And one thing we know as the American Cancer Society is that overall, Black women are underrepresented in clinical trials, in other population-based studies. And so what we are doing that no other organization or anyone has ever done is launching a population-based study that is specific only to Black women. Now, what we're doing is we're looking to enroll 100,000 women over the course of the next 5 years, ideally. In order to be part of this study, you need to be between the ages of 25 and 55, has not been diagnosed with cancer outside of basal or squamous cell skin cancer, and be willing to, it's all online, to take an online-based survey. You take that once, and then you take a 30-minute online survey twice a year for the next 30 years. Now, I know that sounds like, whoa, that's a commitment.
Yeah.
We as an organization have been doing population-based studies for the last 70 years, so we know how to do this. And the goal is to look at, behavior. Let's say it could be eating, it could be physical activity, it could be family history, it could be lived experiences that these women have had. And so what can we as an organization really dive into to put some concerted effort around a community that needs specific attention if we're going to make impact in this disease? So I know that's broad, but look for more information on our website. It's voices.cancer.org. It's really a powerful study that we're dedicated to and committed to looking at.
And I will say this, Jenni, this is talking with you. There's so many resources that you've been able to share. And I know that we only have so much time, and I'm sure you could keep going on, which I appreciate so much. And it's a very, I think, personal topic that I think so many people in our population have a connection to someone they have unfortunately lost or are currently struggling with cancer. And I think what you've shared is great just for education, for resources, for families that need to know where to go, but also just sharing the passion and the long-term commitment of the American Cancer Society just to continue to find, cures, to find better treatments, to just, give that extra focus and hope to individuals. And I love the saying that you mentioned, I love you, get screened. I think that is one of the most important things that you've shared, along with so many other things. So, Jenni Beamer with the American Cancer Society of Michigan, thank you so much for coming on the Community Collective podcast and just sharing your passion and commitment to what's going on and sharing the accomplishments that you all have made and continue to set those goals to reach more and more every day.
Oh, thank you, Travis. I really appreciate it. And I would just encourage, I know this is the Community Collective here in Davison. I certainly always welcome a conversation if someone wants to ask me a question or talk more, because, we've only been able to kind of touch the tip of the iceberg in terms of ways you can get involved and why and how we're looking at really impacting this disease in a really comprehensive way. But there's something for everyone.